Assalamualaikum warahmatullahi wabarakatuh, and hi to Madam Maisara binti Muhammad Saleh and my fellow friends. Welcome to our presentation. In this presentation, we will talk and explain about the exercise for chronic diseases, which is for pregnant women. Okay, before we go further, let me introduce myself and my groupmate first. My name is Nur Al-Aini binti Raizan from SR134B. My four other groupmates are Putri Aini Sofia binti Saleh, Ismail Lokman bin Jamari, Nur Najiha binti Roslan, and the last one is Karul Deni Adam bin Khairul Azma. In this slide, you can have a look on our table of contents. We have introduction, exercise purpose, physical concerns consideration, and functional concerns consideration. And the fifth one, we have psychological and emotional consideration, general exercise recommendation based on FITT principle, and then 3 weeks exercise program. And the last one, we have our conclusion. Here are some introduction about our topic. So, pregnant women also required to do some exercises. It may reduce the risk of developing conditions that associated with pregnancy. So, in exercising, there are some important concerns for them. For example, the physical concern, functional, psychological, and their emotional. All these will influence pregnant women in exercising. So, exercise play an important role in order for pregnant women to give birth in a normal delivery. So, being active by doing regular moderate exercise before and after you get pregnant will help you have a healthy pregnancy and birth. So, research has shown that being active before and during early pregnancy can reduce your risk of having problems in pregnancy, such as gestational diabetes and preeclampsia. So, let's move on to the next slide. Here we can see the exercise purpose of pregnant women. So, first, to decrease the risk of gestational diabetes, preeclampsia, and cesarean delivery. What is gestational diabetes? Gestational diabetes is a high blood sugar that develops during pregnancy and usually disappears after giving birth. There are two classes of gestational diabetes. First, women with class A1 that can manage it through diet and exercise. So those who have class A2 need to take insulin or other medications. So what is gestational diabetes causes? When you eat, your pancreas releases insulin, which is a hormone that helps move a sugar called glucose from your blood to your cells, so which use it for energy. So during pregnancy, your placenta makes hormones that cause glucose to build up in your blood. So usually, your pancreas can send out enough insulin to handle it. But if your body can't make enough insulin or stops using insulin as it should, so your blood sugar levels will rise and you get gestational diabetes. Okay, so here's some risk factors of getting gestational diabetes. First one is miscarriage, have a high blood pressure, high cholesterol, heart disease, or other medical complications, and overweight. So next, what does it mean by preeclampsia? So preeclampsia is a pregnancy complications characterized by high blood pressure and signs of damage to another organ system. So most often, the liver and the kidneys. Preeclampsia usually begins after 20 weeks of pregnancy in a woman whose blood pressure had been normal. So left untreated, preeclampsia can lead to a serious, even fatal complication for both mother and the baby. So if you have preeclampsia, the most effective treatment is delivery of your baby. So even after delivering the baby, it can still take a while for you to get better. So these are some symptoms of preeclampsia. You might assess the protein in your urine, which is you have a kidney problem, and then you have a severe headache, nausea, and vomiting, and shortness of breath. So next, what does it mean by cesarean delivery. So for your information, there are two types of birth delivery, which is normal and cesarean. So cesarean delivery, which is known as C-section, is a surgical procedure used to deliver a baby. So through incisions in the abdomen and uterus. So a C-section might recommended if you have a severe health problem. So the C-section is the biggest fear for pregnant lady because the process of healing take more longer time than a normal birth. So another purpose is to have a healthy weight gain during pregnancy. Okay, and gain fitness and strengthen the heart. So pregnant women should ask their healthcare provider how much weight they should gain. It's especially important to gain the right amount of weight when you are expecting the baby, because the body weight will affect the baby weight, and because babies are often born before the due date. So a higher birth weight is important for their health. So is it safe to lose weight when we are pregnant? So if a woman is a very overweight when they get pregnant, their doctor may want them to lose weight. So they should only lose weight under their doctor's care. So but in the most cases, women should not try to lose weight or diet during pregnancy. But you can lose weight with doing moderate exercise that can help burn excess calories. So we will see in the further presentation for what exercise that's safe for pregnant women. Last but not least, reducing the back pain. So back pain during pregnancy is a common complaint and it's not surprising. So when pregnant woman is gaining weight, the center of gravity changes and your hormones are releasing the ligaments in the joints of the pelvis. So often, however, you can prevent or ease the back pain during pregnancy by doing exercise. By doing exercise, it can maintain the good body posture too. So that's it all from me. I pass the next slide to Nur Najiha binti Roslan. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Najiha binti Roslan and I'm from class SR 1134B. So now I'm going to present about the physical and functional concern consideration for pregnant women. Physical and functional concern consideration are the limitation movement that pregnant women cannot do. Okay, there are several movement or exercise that pregnant women should avoid. Include do hot yoga or overeating, exercise that involve flying flat on your back, jumping or bouncing, and the last one is exercise that needed to holding your breath. So for the first exercise that you should avoid during pregnancy is do hot yoga or exercise in super hot weather. Okay. Any exercise or environment that raises your body temperature more than 37 degrees should be avoided since it causes blood to be shunted away from your uterus and to your skin as your body attempt to cool off. That means you should stay out of sauna, steam roof or hot tub. Next exercise that you should avoid during pregnancy is the exercise that involve lying flat on your back. The exercise that involve lying flat on your back for long periods of time are off limits after the 4th month, since the weight of your enlarging uterus could compress major blood vessel and restrict circulation to you and your baby. That in turn could make you feel nauseous, dizzy and short of breath. Okay, for the example, the exercise are push up and sit up. Next, there are the most important movement that you should avoid during the pregnancy, which is the jumping and bouncing. Okay, they are the best avoided, although otherwise aerobic activity is perfectly safe or as long as you are comfortable and can easily keep your balance. Okay, the reason why you should avoid this movement is because it can prevent from your high impact for your baby. Last but not least, exercise that you should avoid during the pregnancy is the exercise that needed to hurting your breath. The exercise that needed to hurting your breath is never recommended during the pregnancy, since both you and your baby need a constant flow of oxygen. Breathing is the way for you to keep the oxygen in your body. For the next presenter, I will pass to Ismul Lukman.
Now, let me introduce myself. Assalamualaikum warahmatullahi wabarakatuh. My name is Ismul Lukman bin Jamari, and I will tell you about the psychological and emotional for the pregnant woman. There are 6 in this topic, and let's go through one by one. Okay, the first one is depression. The change in appetite, such as eating too much or having little interest in food. Change in sleep, such as difficulty sleeping or sleeping too much, lack of energy, feeling sad, hopeless or worthless, and loss of interest or pleasure in activity are all signs that she is depressed. Miscarriage, delivery before the due date, or preterm, and giving birth to a tiny baby can all be caused by depression during the pregnancy. But don't worry, depression can be treated. You are just going to undertake a social support or family therapy together with your partner or your children. Individual treatment, such as speaking one on one with a family psychologist, psychiatrist. Next is anxiety. Anxiety is defined as a state of discomfort, concern, or fear that might be moderate or severe. Everyone has anxiety from time to time, but some individuals struggle to keep their fear in mind. Some people who suffer from anxiety also experience panic episodes, which may be terrifying. The nervous mother or pregnant woman will experience anxiety all or most of the time and will unable to regulate it. It will make them cause to be worried and concerned. This feeling can be cured by discuss your feeling with someone you trust and try not to feel guilty or humiliated. The second step is to refrain from smoking, drinking alcohol, and consuming caffeine. This item is dangerous to both of you with your kid. Finally, try to exercise and learn easy relaxation exercise. Next is stress. If your friend has depression, then you might get this sign: change in appetite, insomnia, or lack of energy. During pregnancy, your body undergoes many changes, which can make it hard to handle. This change can also affect your moods, making it hard to manage. High level of stress can also make you more prone to suffering to the chronic illness. It can also increase your chance of suffering from heart disease and high blood pressure. But hey, some stress can even be good. Doing these simple things will keep you focused and energized, which will help keep your stress level down. It can also help keep you feeling good. One of the best stress buster is exercise. It can help lower stress level and boost mood. Drinking plenty of water and eating well will help you maintain a healthy weight and lower your anxiety level. Getting enough sleep can help you recharge and regenerate. It can also help you get back on the track on the stressful day. For loss control, self-esteem, and body image concern, this is normal for a woman because they want to be the best version of them. Beauty and high attention should be given because their hormone can erratic. This may seem normal, but this can cause excessive depression and lack of self-confidence for them. On the other hand, we, as a close friend or family, should give word of encouragement as example. Hi, you look beautiful today. And yes, I mean you. And also who watched this video too. Every word you give will inspire them to go through the days to come. In addition, if we want to add confidence to their body, we can help and tell them by doing exercise that match their current body condition. Therefore, I will hand over the slide about exercise to my beautiful friend Putri Ainin Sofia.
Assalamualaikum, my name is Putri Ainin Sofia Saleh. In this video, I'm going to explain about general exercise recommendation based on FITT principle. It is beneficial for pregnant women to do some kind of exercise to strengthen their body and to help them to carry their weight of their baby. And it also improve their endurance and also their stamina. Added endurance from the exercise will help them to nice and easy delivery. 140 is the maximum heart rate for pregnant woman who wants to do exercise because it is a primary concern for the blood flow to the baby. If the exercise intensity increase, the blood flow to the working muscle also will increase and it will cause a decreasing in the blood flow to the baby. If the blood flow to the baby decrease, it will cause several complication for the baby. For the mommies, they need to avoid the torso area because the area needs to be spacious. Do not delay or do a twist movement, and always seek for a professional advice before do any types of exercise. As we can see here, this is a 1 week exercise training for the mommies to do. For the pregnant women who have been participating in resistance training before, they can continue doing it by doing a light to moderate weight training. This is to prevent their muscle from excessive stress. The duration is about 30 to 40 minutes, but it depends on the mother itself. If they feel tired or they feel that they can't do it anymore, so they need to stop, and they also need to stop before any fatigue set to avoid any complication to themselves and also to their.
Hello and Assalamualaikum warahmatullahi wabarakatuh. My name is Khairudin Adam bin Khairul Azmat and I am from SR113 4B and I will continue the presentation. Maintaining a regular exercise routine throughout your pregnancy can help you to stay healthy and feel your best. Here are a few exercises that can help you throughout the pregnancy. First is the pie squat. It is good to strengthen the leg for the third trimester as the belly is getting bigger and heavier at that time. The pie squat targets the quadricep, hamstring and butt and also improve the balance. Next, a pregnant woman can also do plank. This exercise is a static and endurance-based exercise. This exercise is good because it strengthens the abs and the back of the person doing it. Plank targets the core, arm and the back. The third exercise is the bicep curls and lift. This exercise targets the bicep and shoulder and is beneficial after the baby is born as the mother has to carry the baby often. Kegel exercise help to strengthen the pelvic floor in preparation for labor and delivery. Last but not least is one arm row. This exercise helps strengthening the back to help the posture which is being compromised by the growing of breast and the belly. The table beside me shows this exercise being done for 3 weeks. Week 1, we will do this 5 exercise 7 repetition for 2 sets. We can see in the next few weeks, the repetition increase to 10 and 13 repetition in the second and third week. We can do this exercise for about 3 times per week. Now it is for the conclusion. As we all know that exercise is one way for a pregnant woman to stay healthy, she must also put in all consideration from physical concern to psychological concern to avoid any injuries or emotional breakdown. That is all from me and my group mates. Hope you guys enjoy the presentation and thank you for watching. Bye.